right. So I think everyone probably got the same little recorded note that I just did, saying it's recording, so we'll get going. As people keep trickling in, I'm sure there'll be a few latecomers. Thank you so much again for joining this morning. My name is Jahan Casey, and I'm very happy to welcome all of you here today. I am the Director of the First Nations Public Service Secretariat, and welcome for our webinar video meeting this morning on COVID-19 vaccine policies in the First Nations workplace. I am, like I said, it is beautiful and sunny where I am today right now. I'm on the unceded territory of the Musqueam, Squamish, and Tsleil-Waututh. I'm very grateful to be here. A little bit about myself, like I said, I am very proud to lead the team at FNPSS. I am of Haida descent on my father's side, a member of Skidegate, mostly Irish on my mother's side, and lead a team of 12 that run most of these here at FNPSS, our webinars, our videos, our toolkits, everything else that we do in our effort to support First Nation administration capacity in BC. We have two guest speakers here today. And I won't take much more time except leaping into them because I'm assuming we'll have lots of questions. Thank you everyone who already submitted questions through the registration. We'll try to address as many of those as we can. Before I jump into there, a few housekeeping. Like I said, you probably got the little box that tells you we are recording. We will be recording today and posting this on our social media channels. If you would prefer not to be seen, please feel free to turn off your camera, although you're welcome to leave it on so we can see all your wonderful faces as well. If at any point throughout the discussion you want to ask a question, I think most of you have found that chat box or have used Zoom enough over the past 2 years. There is a chat box down at the bottom. You can type your questions in and we'll do our best to monitor that. Please also feel free to raise your hand. There should be a little reactions button on the bottom. It's got a smiley face, and usually in there is a hand raised function. If you click on that, we'll also try our best to monitor that and allow you an opportunity to ask your questions to the presenters as well. And hopefully we'll get through as many as we can. So we're going to start with a bit of an overview from Scott and Josh. And then, like I said, hopefully leave on enough time for questions. And with that, I can see that it is lovely in most places, cool and sunny, which I'm glad to hear. Seems like we're off to a good start for today. So I'll introduce our two presenters. We are very grateful to have two lawyers from Harris & Company's Indigenous Law Practice Group here with us today. Scott McCann has worked closely with First Nations, tribal councils, and organizations across British Columbia, Alberta, Yukon, and the Northwest Territories. He has a deep understanding of the unique requirements and challenges that can arise in the First Nations workplace. His practice focuses on human resources, terminations, policy development, and human rights. Joshua Sutherland is of Ojibwe descent and a member of the Red Rock Indian Band of the Lake Helen Reserve. He's a trusted legal advisor to First Nation and Indigenous clients, both on and off reserve, as well as to federally and provincially regulated employers. With a listen first approach, Josh guides his clients on best practices on terminations, wrongful dismissal claims, human rights issues, disability accommodations, performance management, and presents training modules for clients, as well as so much more. And we've worked with Scott and Josh for some time, and I can attest that they both do so much more. Josh is no stranger to the courtroom, having appeared at the Supreme Court of Canada and every level of court below in multiple provinces, and has conducted various other matters before tribunals, adjudicators, fatality inquiries, to name just a few. And I'll stop there. I'll let either Scott or Josh add to that if you'd like. And with that, I'll turn it over to you to kick us off.
Oh, you're on mute, Josh.
Well, that's a good way to start. Yeah, as I say, in about 5 minutes, you'll probably wish I was still on mute, but here we go. Thanks everyone for allowing us to join today and present on this topic. and thanks for that introduction. It covers off most of what we were going to say. Other than Scott and I have been able to join forces here. Recently I moved from an Alberta-based law firm to BC, which made sense because, Scott's been assisting First Nations and their related entities for 20 plus years, and I've been doing it for about 12 years or so. And we joined forces, so now we represent a lot of First Nations, in most of Western Canada, spanning various provinces and some of the territories. And one of the very hot topics, in recent times is COVID-19. In fact, it's so hot, I can feel it burning on my neck. But then again, that could just potentially be the sun behind me. So, but it's a good euphemism, I'm sure, for what's been going on lately. Just a quick caveat before we get started here is that, one of the things that can happen in these types of discussions, particularly on this topic, is that it can kind of morph into something it's not intended to be. And that is either, a political debate on the efficacy of vaccinations or where people lie in terms of their personal beliefs. When it comes to the Q&A period, if we can just minimize, kind of that debate, as opposed to talking about the legal considerations that this has in the workplace, particularly in the First Nations context. And Scott and I have had an opportunity to review some of the questions that were sent, and they were all great questions. And in fact, I think you'll be pleased to know that a lot of them, if not all of them, will be addressed likely in the presentation. That said, we do prefer to do this kind of more as if we were all in person, which of course is our preference, so that you don't have these two bobbleheads on a screen, Scott and I talking to you the whole time. So we're happy to engage, we're happy to answer questions as they come in. But again, on this particular topic, it may be worthwhile just listening to the presentation as a whole, and we can address any remaining questions at the end. But I leave that up to you as the audience. And with that, we will transfer over to the legendary Scott McCann.
All right. So I'm just sharing my screen, and I'm just going to pull up the picture in the PowerPoint here. All right, so today we've been asked to talk about COVID-19 vaccination policies, and in particularly the First Nation considerations that go into the types of policies that have been passed. Now, we've been asked by a number of different clients, a number of our First Nation clients to assist them through the process of passing mandatory vaccination policies, and we've learned a lot along the way, and we're just trying today to share with you some of the stuff that we've learned in doing that, and some of the more practical and legal considerations that any of you that may be considering this either for your nation or for your nation related entities. What are the things, what are the obstacles, what are the risks, what are the practical considerations that you should be taken into consideration, and then what would a policy look like? And so we're going to cover off all of that as best we can. The first slide here, just talking about why you might want to, why is this an important topic, why you might want to be considering vaccination policies within your community, showing that the number of confirmed hospitalized in Canada from December 14th, when the vaccinations first start coming out, to October 30th by vaccination status, you're looking at a huge difference. The unvaccinated, 37,742, as compared to, you'll see the cases not protected, 2,883, partially vaccinated 3,000, and fully vaccinated only 2,600. And so the numbers with respect to hospitalization are pretty clear, that vaccination does have a positive impact, leaving aside the issues that Josh talked about on personal choice and preference with respect to whether or not people are wanting to get vaccinated. And so this particular issue is a hot button topic and creates a number of can create a number of issues in the workplace. And what we're going to do today is just try and provide you with some practical considerations and a way to anticipate these issues that might come out, so that you can think about it before you put a vaccination policy in place, so that you're not taken by surprise when these issues do arise. And so the first question for the nation to consider is, do we actually need a vaccine policy? Do we want to have one? Are we required to have one? And so the first part, I got a lot of inquiries early on when the federal government started making vaccination policies mandatory for federally regulated workplaces. So where it stands right now is federally regulated workplaces, only specific ones are required to have mandatory vaccination. So that's your air, rail, road, marine transportation, pipelines, banks, postal services. And it includes any employees who are teleworking or working remotely or working on site. So the federal government has decided to take a broad approach to vaccinating, and they've actually recently announced just yesterday that they're going to extend this to all federally regulated workplaces. And so they made this big announcement, and it came out yesterday, and I read it and thought, oh wow, this is going to change a lot. But what they did continue to keep in is an exception, and that exception is for Indigenous governing bodies and First Nation band councils. And so what they've said there is, in recognition of Indigenous people's right to self-determination and self-government, Indigenous governing bodies and First Nation band councils will be exempted from the new requirements. The Government of Canada will work with Indigenous partners to provide information on the new measures, should they wish to follow the same approach. However, doing so will be at their discretion. This is also in line with the government's commitment to implement the United Nations Declaration of the Rights of Indigenous Peoples. And so essentially what the government has done here, they've made the right decision, in my view, in leaving this up to the First Nation governments to governments to decide what they want to do and how they want to do it. The downside is that it does leave the nation with to tackle a very difficult issue, and one that does come with some risk. And so had they included nations in their federal mandate, then the nation would just have no choice. They would have to implement this policy, but then the risk would be taken away, because it's essentially you're just following the requirements of the federal government. Now, what they've done is properly given this decision to the nations to make, and now the nations have to decide, you know, is this something we as a government want to follow for our membership? And so, and now on top of that, a lot of you all obviously would also have other entities beyond just the administrative staff, the administrative employees. You may have private economic development initiatives that you're operating. And so the considerations for those entities, you need to keep in mind, are different than for the nation. So when you're talking about the private sector, so when the first two sections in here on the slide is this public sector, and that's referring to the provincial government, federal government covered by the charter. And you can see there's a charter analysis there. Doesn't really change that much. Unionized, if you have a union, there's a slightly different analysis to apply for if you're going to pass a policy. It has to pass what's called the KVP test, which is essentially, is it a reasonable policy? And so if you do have a union and you're considering passing this, you have to consider whether or not it meets the KVP test. And there's also other considerations that have been raised recently of do you have to provide advance notice to the union about this? You have to look at your collective agreement to say if there's any restrictions. Assuming there's no union, then you get into what applies to every entity, which is There's privacy obligations on you. You have to, when you are collecting information, you have to make sure medical information such as your vaccination status, you have to make sure you're complying with all the privacy legislation. There's human rights obligations, which we're going to talk about in some detail, that have to be met with any vaccination policy, and this would apply to all organizations. Bullying and harassment issues that we're going to talk about, and then you're covered by statutory immunity. The statutory immunity is essentially legislation that's been passed that says that if you're complying with the public health orders, federal or provincial public health orders, you can't be sued for implementing those obligations. And so when you're looking at when the nation, if the nation itself is looking at, do we want to have a mandatory vaccination policy? This is something that the government for the nation is going to have to decide for themselves. We've outlined here, you know, the chief and council obviously has fiduciary duties to act in the best interests of membership. The chief and council will have to decide on their own whether or not a mandatory vaccination policy is in the best interests of the membership. And some of the factors that they may be looking at is considering whether or not this mandatory vaccination is a good policy in order to protect the membership, in order to increase the overall vaccination rates within the community. So this is essentially the same strategy the federal government and provincial government is using. They want to increase overall vaccination rates within their community. And so they're implementing this policy in order to help do that, and also to help decrease the spread of COVID-19. So you can see that when it comes to a First Nation government, if they go through this process, council goes through this process and decides they think that a mandatory vaccination policy is in the best interest of the membership and in the best interest of increasing overall vaccination rates, then it's likely going to be found to be a reasonable policy to apply that. You know, if even as a general mandatory vaccination policy for all employees, if you're applying that same test, as I'm going to talk about, to a private corporation, then it might be a little bit more difficult to justify, because it's not really up to a corporation to try and improve the overall vaccination rates in the community, I guess, depending on the size of the corporation. But if it's set by council, then it's a lot more defensible, because they're not just looking at the employees within in that workplace, they're looking at what's the overall effect of this policy on the whole community. And so those are things that the council will have to decide, and whether or not that's something they want to know. Now, one of the things that I want to point out as a practical consideration is councils should, and most of the councils I've dealt with are aware of this information, but they want to know, you'll want to know, what is the current vaccination rate within our community? If the current vaccination rate in your community is, you know, high 90s, similar to what's in the community generally, then in BC generally, then you're probably looking at pretty high buy-in to this type of policy. And when you're looking down the road, how is this policy going to affect our employees? You're looking at that as a factor of, okay, well, assuming that those vaccination rates are consistent within our workplace, we're going to have potentially roughly 10% of our workplace that may not be vaccinated. And so if we're passing a policy and the ultimate end result is that those employees may no longer be working for the organization, we need to be able to anticipate that that might happen, and are we willing to take that on if we're going to pass a policy? If the nation is concerned about losing those employees and they don't want to take that risk, then that should be something that's taken into consideration early when you're drafting the policy, that there may be exceptions made, where people can work from home. And so all of these things are things that council and those who are involved in deciding whether a policy is required should be taking into consideration. Is this something we actually, A, need and want to do, and B, are we willing to live with the consequences if we lose some employees as a result of such a policy? And so when you're looking at the reasonableness test, again, rules subject to the standard of reasonableness, you're looking at reduction of harm or prevention of harm versus the negative effect of the policy on employees. And is it reasonable in the circumstances? it's going to be likely, if the council's gone through that analysis and decided in favor, it's almost certainly going to be found to be reasonable. The federal government's done it, the provincial government's done it. If the local nation decides that that's what they believe in the best interest of people, it's almost certainly going to be found to be reasonable. These are the typical things you would look at in determining if it's reasonable. Is there scientific support? Is there public health guidance and orders? What's the risk of transmission in the workplace? Is there availability of alternative measures, the existing employer policies or any collective agreement, and any access issues? So you want to allow time for your employees to comply with the policy. So making sure that you're not just springing it on employees without giving any kind of advance notice. Now, one of the things risks that may come up is if you put in a mandatory vaccination policy and somebody goes and gets the vaccination and has an adverse consequence, then this may result in a WorkSafe BC claim because it is now related to their employment. They only went and got the vaccination because of the mandatory vaccination policy. Now, whether it's covered by workers' compensation, again, is going to depend on whether or not it's the vaccination was a direct result of the policy. If it is, then you may end up with a claim. The thing about WorkSafe claims is that obviously they're paid by WorkSafe. It's not a direct liability for the nation, but it could be result in a, if you happen to have a lot of more claims, then it could result in an increase in your rates. Unlikely to happen, and the risks of an adverse effect on vaccination are pretty low, and so the likelihood of that type of claim is going to be fairly low, but something that obviously council should be aware of and consider when they're making their decision. Another issue that isn't often thought about before passing something, but is an important thing to keep in mind, is the issue of bullying and harassment, violence in the workplace. You all have obligations with your employees, as you know, to make sure that it's free of bullying and harassment or any violence. And so, as we said at the outset, vaccination is a polarizing issue. It's something that can create internal issues within your workplace. So it can be a source of bullying and harassment in the workplace. Some employees, keeping in mind, some employees may have protected reasons, so human rights reasons why they're not being vaccinated, subject to an accommodation that we're going to talk about. So just be cautious of stigmatizing, ostracizing, or any bullying that may be going on in the workplace based on someone's vaccination status. So if someone is not being vaccinated because they've got a medical exemption or they have a religious exemption, be careful that they're not being bullied or harassed within that workplace. So when the nation, if the nation does decide, or council does decide, look, this is something we're interested in doing, we want to pursue this, then they are taking on some risk in doing it. So if they have, and I'm just going to talk briefly about these risks, and this is the risks that they'll have to weigh with, we're doing this to protect our community, we want to protect our elders, we want to have a safe and healthy community. Are we willing to take these other risks, which is you may get if you have a union, you may get a grievance filed. If you don't have a union, someone could claim at the end of the day that you may have to make a decision to terminate that employee. They may claim that they are being wrongfully dismissed because of that and claiming damages. Now, the courts haven't made a determination on that yet. Our view is that if you've passed the policy properly and you've gone through all the steps, and they're just simply choosing not to become vaccinated at the end of the day, that wouldn't be a wrongful dismissal. That would be a just cause dismissal. But that issue is still to be decided, and so there is a risk that you may owe some damages, which would be the notice that they would have been entitled to had you terminated their employment without cause. As you're covered by the Canada Labor Code, there's a risk that an employee could file what's called an unjust dismissal under the Canada Labor Code, which is essentially a process saying that they've been terminated unjustly. Again, it hasn't been decided. Our view would be that this would not constitute an unjust dismissal. This is a health and safety policy, and they're choosing not to follow it, just the same as any other health and safety policy. Person refuses to follow, their employment comes to an end. They're either, the contract is either frustrated or they're terminated for cause for not following the policy. But again, it's not been definitively determined by the courts yet. If you don't follow the privacy requirements and maintaining the privacy of that information, you could be subject to a privacy complaint. This one's pretty easily dealt with within your policies to make sure that it's done right. The policies that we draft cover that off, and so there shouldn't be a problem unless there's some kind of breach contrary to the policy. You may end up with a human rights complaint, and so we're going to talk more about this in detail, but essentially the human rights complaint would fall under the category of I can't get vaccinated. I am not getting vaccinated for the following reason, either be religion likely or medical, and you've evaluated that request and decided you're not going to allow it. They could file a human rights complaint saying that you're discriminating against them on the basis of their religion or their medical status by not accommodating them and allowing them to remain unvaccinated and still work. Again, WorkSafe BC, I've already gone over that. There may be an adverse reaction to the vaccine. So some of the other risks, I've talked briefly about this, but this is, really something that council and those of you who are advising council need to take into consideration is what is going to happen if we pass this policy. So when you look at the policies, and Josh is going to take you through the standard policy, you're essentially going to be giving them an opportunity to go get vaccinated, and you're going to give them a deadline. At the end of that deadline, then you're usually going to put them off on a unpaid leave for a period. And then at the end, you're going to have to make a decision on whether you're going to terminate their employment. And so can you, as an organization, take the risk that you're going to lose some employees as a result of this? Or do you want to build in some safeguards so that if you decide that there's an employee that you really don't want to lose, that is not willing to get vaccinated, that there's some other accommodation for them, like working from home, working remotely, that you're willing to consider? And so there's all different ways of building that into the policy, but it's something, you don't want to be taken by surprise where, oh, this sounds like a great idea, let's pass the policy. Oh, by the way, we only have a 40% vaccination rate among our employees. We're about to lose 60% of our employees, right? You want to get out ahead of that, have an understanding of where you're at. One thing you might want to consider is doing a poll within the confidential poll within the workplace, just to see what your vaccination rate is. And so you know what you're dealing with when you're going into this, passing this policy. So this could result in interruptions to your operations, scheduling issues. And so again, that current vaccination rate can be a good predictor of what kind of impact this policy is going to have on your organization. And so I'm going to turn it over to Josh right now, and he's going to talk to you about drafting that vaccination policy. Stop sharing here. You're on mute now, Josh. So.
I love that little button. I wish I had that button for my kids. I'm going to try and share my screen here, Scott, but I was having a little bit of trouble with it earlier. While inconvenient.
If it doesn't work, I can help share.
Yeah.
And perhaps while you guys are screen sharing, I'll just say that we are tracking the questions coming in the chat, and we'll make sure that they get answered as after we end the presentation.
Sure. Is it working, Josh? Or?
Yeah, no, do you mind? Well,
I'll just share.
Yeah, sorry. I know that that's not as convenient.
That's all right.
I don't know exactly what was going on, but alas, here we are. You'd think of 2 years of doing this, there would be a certain degree of perfection with organizing these things, but alas, here we are. Okay, so I'm going to talk to you a little bit about drafting your vaccine policy. And I guess to kind of start is, a lot of people ask, are we even allowed to introduce these policies? Well, it's no different than any other policy that an employer will have in respect to, introducing a code of conduct, or introducing a disciplinary policy, or introducing, vacation or leave of absence policies. This policy is no different. And in fact, all policies are meant and designed to be kind of a living document that are living in the sense that they can change to address various situations in the employment context as they arise. This is also in keeping with, the general principle that the law recognizes the employer has the inherent right to manage its workforce. Now, there's certain parameters around the managing of any one workforce, such as human rights, privacy, health and safety legislation, and the common law generally. But introducing policies, particularly in the COVID vaccine era, is no different. Of course, it's always going to come back to, okay, is this reasonable? And you heard Scott just address, some of those items. Now, another question that we often get is, do you have a template that you can just send to me? And the answer is no. As you saw earlier, these things can be so nuanced and have such varying degree of application depending on the specific client. Now, that said, there are obviously going to be very certain items that must be addressed, right? So there are a few topics, scope, application, human rights, privacy, et cetera. And we're going to go over those in a moment, and how those can vary in each workplace. And it really takes one-on-one consultation in order to figure out, how that a policy is going to apply in your particular workplace. And, some may want very strict policies so that it's 100% mandatory vaccination. Others are going to have, our workplace or our community or our nation, operates a little bit differently than others. So we're going to build out a bunch of different exemptions that will accommodate, people who choose not to be vaccinated. So if we go to the purpose of the vaccination, this is really your opportunity to review the science and justify it as the reasonableness for the policy and why it is that you're introducing it. So the employer has, as you probably all know, a general obligation and duty to protect the health and safety of its workforce. And introducing a COVID policy or a mandatory vaccination policy is just in keeping with that duty, because it's pretty clear. We've heard a lot of unfortunate stories from a lot of our First Nations clients, particularly smaller communities with a high percentage of elders, as to the devastating effects that COVID-19 has had on its population. And so COVID-19 is a health risk, and you have to be able to manage that. And vaccines, at least on that very initial slide that Scott showed of, the some odd 38,000 bar graph to the 2,600 bar graph as the difference between vaccinated and unvaccinated individuals, is that it is showing, the science is showing that it can be effective. So, almost on its face, that is a justification for the vaccination policies and the purpose of which it is that you're introducing it for your particular workplace. And then from there, we want to address the scope. And when you address the scope, you'll see that, it can have varying degrees of application. Is it going to apply to just employees, or is it going to apply to employees, contractors, volunteers, customers in the public sector, or maybe, even your own membership coming into the administration building or using other public works or services? How is that going to play out, and who does this apply to? You really only have control over your employees in terms of introducing the policy and the effects that it's going to have on the employment. But you can, in certain circumstances, prevent services from outside people coming in. For example, if there's outside people or non-nation members coming on to reserve, you could, in effect, have like a little checkpoint with, security or some other staff that checks vaccinations as they come onto the reserve as a mechanism, to prevent the vaccine from coming on to the reserve. Where I'm from, the Lake Helen Reserve in Northern Ontario, we have a lot of fly-in remote reserves that are dry, and they have very similar checkpoints, at the airport and the highway coming in, if they're lucky enough to have a year-round highway, for checkpoint for things like, contraband, alcohol, and the like. So, this policy can have that similar type of scope, but, you're also going to want to consider, does this apply to remote employees? And is it necessary for it to apply to remote employees or employees working from home or currently on leaves of absence? Or is it such that when they return from their leave of absence, they then have to come up to the current standard of the policy of being vaccinated? Again, a lot of questions to address in just that initial scope aspect. And then the next thing you're going to want to consider, which is the next slide, is vaccination requirements. And sorry, Scott, if you don't mind just flipping over to the next slide there.
Sorry.
Yeah, sorry about that. So vaccination requirements, just like the scope, this can have varying degree. And are you going to have a mandatory vaccination policy? And if so, how are you going to transition? And what is the time frame of the period of time from being either partially vaccinated or not vaccinated at all to coming up to speed with the policy and being vaccinated? So, for example, one of the things that could cause problems is during that transitionary period, what happens if your particular employees are providing services to a third party? And that third party, whether it be, a government, provincial or federal, or a municipality, or just some other type of private sector third party where they have a policy such that you can't work for them or, provide services on their work sites without being fully vaccinated. And then on the back end, you have your employees who are either unvaccinated or in the transitionary period of having first vaccination to second vaccination. How do you deal with that? Do you reach out to that contractor or third party to see if they can make an exception to that rule? Or do you have to address and adjust the scheduling period of people within that transitionary period? There's also hybrid considerations of the policy, that all employers can take into consideration. So a few of those, or at least three that we've identified in these slides, is, are you vaccinated or can you just subscribe to testing? And that testing, depending on the circumstances or how frequent they may be, may have to be borne by the employee or borne by the employer or shared, right? These are all things that need to be discussed and included. Also, what happens if, is it going to apply to people who aren't necessarily, working with others? Are they working remotely? Are they working from home? Or do they work in outdoor settings such that, the risk isn't as great, right? And how do you balance all of those various employment circumstances? That may be highly different than someone working in a tribal administration building or, a chief and council, or, in one of the public works buildings, in an administrative role where there's people in and out of the building all the time, lots of shared high touch areas, coffee machines, water, water coolers, lunchrooms, etc. So again, a lot needs to go into the vaccination requirements and who is it going to apply to. Now, the next part of the policy that you'll want to address is the proof of vaccination. And so, this can also happen in varying degrees. So is it just an attestation that the employee says, okay, yeah, I've been fully vaccinated, and you just believe that to be true or take it on face value? Or do they have to provide some type of written declaration saying that, nope, I have done this? Or do they have to show proof either by, a vaccination card, what's being referred to now as the passport, Do you have to have a medical note confirming that you've done this? Do you have to show proof of your actual paperwork, that you get that shows the date that you were vaccinated, as well as the vaccine type, right? And, the vaccine type, I believe there's only a varying few vaccines that are available in Canada, but, we have seen scenarios where someone was overseas or even in the United States and said, well, hey, I'm here, it's available, I'll get it. Is this vaccine type sufficient for our purposes? And you as the employer have to decide, what type of proof of vaccination you're going to require, either from your employees, or if the scope is much greater, also from contractors, volunteers, third parties, clients, etc. Now, moving on to the online passport. So one of the things that a lot of people have adopted is just, the passport. And why the passport? Well, in large part because it's simple, it's easy, and to a large degree, it's universally accepted as something that shows proof of. But in addition to that, there's also a few, security or safety measures in terms of it being valid, as well as minimizing the amount of information that is received. And we'll talk about, privacy implications in a moment. But it's an online app. The person who registers for it has to include very personal information, such as their personal health number, their date of birth, and the date and type of vaccines it is that they received, in order for that to check with the BC government health authorities information that they have, in order for you to actually be given your vaccine passport. However, one of the huge benefits of it is, notwithstanding the checks and balances that go through to ensure that the employee has in fact received the vaccination via the passport, is that other than confirming it via the QR code, no other information is passed and or shared to the employer. And that's important because of the privacy considerations, which is our next slide. So, privacy notifications. When it comes to the collection of data, there's always going to be, or there should be a little alarm bell or a red flag that goes, okay, what are the privacy considerations of the collection of this data? And while we're not going to go into the full detail of it, really the general rule is what I'm collecting reasonable, and is it necessary in order to achieve this purpose and or goal? And again, hence why the QR code is good for that. Now, I'm just looking at the time here, and I see that we still have to get to the human rights accommodations, which I assume is going to be a hugely popular topic, which Scott will talk about. So we're just going to jump through this slide, and we'll get to the consequences of non-compliance. And really, there's various options. You can terminate the employee. You can do a leave of absence, if they have sick leave or vacation, or, some other types of paid leaves that they can ascribe to that, then great. But there's going to become a certain point where, their leave is no longer available, at least in a paid scenario. So they may have to go on unpaid leave until one of two things. They either become fully vaccinated, or maybe they decide, hey, I'm going to wait out this whole COVID thing. Let's see what happens. And it may result in the indefinite unpaid leave for that particular employee. Another possible thing is, okay, if you're not going to be compliant with being vaccinated, then you're going to have to go through testing, and you're going to have to incur that at your own cost. So if we go to the next slide here, you'll see that, again, leave of absence and terminations, we just kind of briefly went through that. And again, we'll get to the human rights accommodations. So perhaps Scott will just flip through this slide quickly, because I know that this is being recorded and you will have access to this information on a later date. And same thing, leave of absences. There are legal risks, of course. Scott addressed a few of those. You're going to want to obviously consider the individual circumstances on a case-by-case basis. We are here to assist you if and when that becomes not just a risk, but a reality to you. And on all circumstances, you're still going to have to justify the policy, but nonetheless, one of the risks of this is that the employee can claim constructive dismissal, even if you as the employer don't just outright terminate them. And we can discuss the nuances of that on a later date. Then there's the COVID-19 testing, which is the next slide. And how it is that if someone is going to be accommodated to the point where they say, okay, look, you don't have to be fully vaccinated. We're going to, respect that choice, but here's some other protocols and measures that we're going to have to take in order to ensure, that we're minimizing the risk of COVID-19 and its spread within our workplace. And then the next slide is human rights and, the various degrees of, risks that come with that and or considerations that are required for managing accommodations. And with that, I'll turn it over to Scott, and I apologize that I had to run through those slides a little bit quickly.
All right, great. So the human rights part is one of the more difficult parts to the analysis. So essentially, you get over that hurdle that, yeah, is this reasonable? Do we have a policy? Great, we're gonna enforce this mandatory policy. Everything's going along smoothly. The people that don't want to get vaccinated, they just for personal choice, they end up with all these options that Josh talked about before. The people who are vaccinated, everything's going along smoothly. Then you get a request saying, look I can't be vaccinated because it's contrary to my religion, or it's contrary, or I have a medical reason why I can't be vaccinated. How do you deal with that? How do you deal with that human rights request? So this is essentially what's referred to as a request for accommodation, because what they're requesting for is, yes, you have a policy, yes, it's reasonable, everything's fine, but in that policy, and if you do the policy right, it will have a built-in, if it discriminates against you in any way, there has to be a process for accommodating that individual. And so one way in which it might discriminate, as we said, is based on their religion or based on their medical status, and that they can't do it. So you have to have a built-in way to deal with those issues. So the general duty to accommodate is you have a duty to try and accommodate people to the point of undue hardship. So that only kicks in, just to make it clear, they can't just say, I don't want to get a vaccination, you have to accommodate me. No, it has to be connected to a protected ground under the Human Rights Code or the Canadian Human Rights Act. So in order to do that, the two ones that we're dealing with generally are, I can't get it done because I can't get vaccinated because it's contrary to my religion, or I can't get vaccinated because I have a medical issue. Those are the two significant sources of accommodation. And so the most difficult of those two is going to be the religious belief one. So medical one I'll talk about next, but it is relatively simple. The religious belief is a little bit more nuanced, a little bit more difficult. So the first part of the religious exception is that it has to be objectively required by the religion, something that's objectively required by religion, or subjectively believed to be required by the religion. So that person can be wrong about what their religion says, but they have to genuinely believe that that's what it says or what it's required, or it engenders a personal subjective connection to the divine or the object of spiritual faith. And so this last one is with First Nation communities, what we've seen is some objections based on cultural belief, saying that it's our particular culture within this community that we don't believe in relying on vaccinations or Western medicine or having to go to the hospital or having to deal with doctors. We have different ways of addressing these issues. And so my cultural belief is that I don't need to get vaccinated. Very, very difficult issue to deal with, very nuanced issue to deal with, something that chief and council or whoever's making the decision under this is going to have to take seriously. go through an analysis and decide whether or not this in fact is a legitimate basis for an accommodation. So at this time, again, we don't know. We know that cultural belief is a protected ground. We don't know if that was to be denied, exactly how that would play out at the Human Rights Tribunal. And so in this particular one, you know, one of the, just like a lot of this stuff, we suggest you get legal advice, particularly if you're going to deny the cultural belief. If you're going to accept it, yes, that is actually a cultural belief in our community, and this person genuinely believes that and is a follower of that belief, we accept that, we're going to create an accommodation, then you're just going to want to maybe get some advice how to implement that. But if you're going to deny it, you know, that's not a belief of our community, that's not a thing, then you want to make sure you're just going through the right process and deciding whether or not that in fact is a legitimate cultural belief. And so the test under the Supreme Court of Canada is set out on religious belief and religious accommodation is the religious belief or cultural belief sincerely held by the person? Now, where we run into where the issues that I've seen in dealing with this, you know, someone says, you know, they're anti-vax all the way up until this thing, they're just ranting to everyone who will listen, has nothing to do with their religion or their medical status. Then all of a sudden it comes in, they say, oh, I have a medical reason why I can't be vaccinated. So you ask them for details, turns out there is no medical reason. Then they say, well, wait, I have a religious reason, and they print off some form from the some pastor in the US who said that this is contrary to our religion. There's no, you know, there's a good reason to believe that this is not a sincerely held belief by this person. It's not necessarily there, they know nothing about this religion. At that point, you'll have to make a decision. Is this actually a sincerely held belief, or are they just relying on this as an excuse not to get vaccinated? Obviously, if you conclude that it's just an excuse not to get vaccinated, there's some risk that the person would file a complaint. The tribunal will then have to go through that process. Is this a sincerely held belief? And the way they look at that is going through the same analysis that you're going to go through. You're going to go back and ask them, you know, provide us a bit more information about this. So when it comes to religious beliefs, there's a few that have only very few religions that actually have come out and said that they're contrary, that not getting vaccinated is contrary to the beliefs. There's very, very few. Most of the major religions have actually come out in support of vaccinations. But again, keep in mind that that's the objective part. There may be a subjective belief that this person follows a smaller tenet of that religion that they genuinely believe prevents them from being vaccinated. You have to be able to be open to that possibility. And so in responding to those requests, you want to ask, you know, what religious faith do you adhere to, and how long have you been a member? What is the nature of your religious beliefs that prevent COVID-19 vaccination? And what is the basis for these beliefs? Does this religious belief prevent all medical treatment, all vaccines? If it's only COVID-19, why is it only COVID-19? Because quite often this may just be the person, the reality is they're saying they've bought into a line of thinking that this is a all new experimental vaccine and therefore I don't want to do it. If that's the reason, well, how do they just, you know, how do they, if they're getting other vaccines and they're fine with other treatments, why are they not fine with this one? The fetal stem cell argument comes up a lot as well, saying that this is produced using fetal stem cells, but it, you know, there's a whole bunch of science behind it. I'm not going to get into that, but that same argument doesn't really hold much water, because if they're using other types of medications, the vast majority of medications, the link that they make to the fetal stem cells is linked to the vast majority of medications. If they're taking all those medications, then why are they specifically excluding this one? All those kind of questions you're going to want to ask just to test the sincerity of that belief. Keeping in mind, just like any accommodation process, you want it to be a fair, open, and have an open mind to the process that this may be a legitimately and sincerely held belief. When it comes to a medical reason, we're talking about accommodating a disability. So accommodating, you know, there may be an allergy. The primary one that would be the screening tool. The public health officer has a little list of medical contraindications. You're going to want to get a medical note from a doctor that states specifically what is the reason why this person can't get a vaccine. Keep in mind, there's also mental disabilities that could prevent the person from getting the vaccine. So even if they don't have a specific allergy or something else, that if the doctor, a specialist, is telling you that there's a mental disability that's preventing this person from getting the vaccine, you need to consider that, take that into consideration, and consider if there's a way to accommodate. Again, don't be afraid to ask for further medical information. You want to, when you're asking for that information, ask for as much information as you feel you need to make that decision. So you can inquire about the length of a deferral. I've heard of issues where, you know, someone has an allergy to something that's in the thing, but they're being told by their doctor that it's safe for them to go and get the vaccine as long as they're doing it under supervision of the hospital. And so you want to get all the details out so that they're not necessarily just relying on one specific piece of information and leaving out other information. And so if you do get a legitimate request, you decide that it's a legitimate request and that it is a request for accommodation, then you need to accommodate that up to the point of undue hardship, which means you have to try and find a way for them to continue to do their job even though they can't get vaccinated. So you want to look at, should we be assigning this person to alternative work duties, alternative work sites, working from home, limiting their contact with others? Again, just going through that same analysis we used to do before there was a vaccine. How do we protect people? How do we make it a safe work environment? This person can't be vaccinated. Is there a way we can allow them this routine testing, the rapid testing? There's a cost associated with that, but that could be one of the ways in which you can do that. And so we get to 11:28. How long had we scheduled to go, Bronwyn? Was it just the hour? Or we're happy to stay for a little while to try and answer these questions. There's a lot of material to get through. Sorry.
Yes, we're scheduled to go until 11:30, but as we previously agreed to stay on for about half an hour longer to answer some questions, we'll keep going.
Okay.
Anyone, I apologize, who does have to leave due to other commitments right now, we are going to continue recording and we will post this. And Scott and Josh have also put their emails in the chat where you can reach out to them as well.
Yeah.
So.
And just to give you a sense, we've had to cut this presentation down from a 3-hour one to a 1-hour one. And so there is just a lot to be, a lot of nuance and a lot of issues here. And so we've tried to really hit the highlights, but there is a lot more to, you know, a lot of nuance and a lot of different ways in which we can go. I've seen some of the questions already coming in, just to give you a sense of how many different directions this can go in. How do you want to proceed with questions, Jihan?
Well, maybe I can start if that's okay with, I'm going to go back to one of the first ones that was in the chat, talking about the federal mandate for federally regulated workplaces. And the question was, you mentioned that there's an exemption for First Nations and Indigenous governing bodies. The individual says, am I correct in interpreting that tribal councils are not exempt? Can you clarify that?
That's a good question. I don't actually know the answer to that. I would think that tribal councils would be seen as a governing body as well, and probably would fall. I think it would be safe to say that they are exempt, but they may want to seek. I haven't been asked that question. I represent a number of tribal councils, and I haven't been asked that question yet, so I haven't looked directly into that. But I think they would be seen as a governing body that could make that decision. Particularly, you know, they're depending on the role of that tribal council. Each tribal council is slightly different how they're structured. So some tribal councils do provide far more governance. And so those ones I would say would almost certainly be exempted, but they may want to seek clarification from the federal government when that, because it still hasn't gone into effect yet that it applies to all federal. Right now, they're definitely not required. But when it does come into effect, as I said, it just came out yesterday, so I haven't been able to get the full nuance of it. But my guess is that they will probably be exempted as well.
Thank you. I'll go on and I'm going to read this directly as written because I'm not sure if I'm interpreting it correctly. And if I'm getting it wrong, maybe Elton, you can jump in and fix my understanding. So our BAM Council has not implemented a vaccination policy for staff, but has made it mandatory to be fully vaccinated to enter our admin buildings as well as our venues. This includes any events facilitated by our nation. Is that sufficient, or does it have to be a blanket policy that includes everyone? And it's the last question about, is it sufficient? I'm not sure I'm understanding.
Okay.
I'll let you jump in.
So yeah, sufficiency is really going to be up to them as a council to decide whether that's sufficient or not. So, I saw some other questions as well about, and we're not going to get into outside of the workplace, but essentially the many nations have used their bylaw powers to pass bylaws saying you can't come into the community, or you can't access the community center, or you can't do whatever it is without showing your passport. And so there's certain risks associated with that, but it's a lot different analysis than the workplace one. And so if the council says, you know what, that's all we need for our community, we don't need to make a mandatory vaccination for all of our employees as well, that's a decision that council can make. If council feels that's not going far enough, many councils have approached me for that exact reason, saying, well, this doesn't make sense. We've got people working in here. We haven't even required them to be vaccinated yet. We're requiring everyone that comes in to be vaccinated. How is that fair? So it's, that's something that council will have to decide whether in fact they think that's sufficient or not.
Which I think leads into another question that Andrea was asking, is if they have a policy for access to building and events, but not one for staff, but a staff member who's not vaccinated is working at that event, how does that policy apply? Would that be within the policy?
So yeah, so it would be, so there's a bit of nuance there, because in order to get into that building, the requirement is that they be vaccinated. And so the issue is, can that employee enter that building without being vaccinated? And the answer may be no, because it would be the same reason as if they couldn't come into the community. But then you'd have to decide, okay, well, it's just the same as not having a certain safety qualification or something to enter. If your job required you to wear a hard hat to go work at a certain site, then you got to decide, well, if this person's unwilling to wear a hard hat, how are we going to deal with that, right? And so it's a slightly different analysis, because it's not a mandatory policy for all employees, but it's, part of your job is that you're going to have to go to, this particular facility where you have to be vaccinated. It's much easier then to enforce that on that individual. You don't need a blanket policy for that.
Okay, so question, would an employee that refuses to get the vaccine and is terminated be entitled to severance?
So as I said at the beginning, that's we say no. That's the position that I'm going to be taking in court, probably soon enough. But it's not decided yet. So if you're on TV and you watch these guys that are trying to drum up business for individuals, they'll tell you that, yes, we're going to get you a severance package if you get fired because of the vaccine policy. I think that they would have a weak case going in. I think that these policies are reasonable, and if they're passed properly and implemented properly and done properly, then severance won't be payable if someone's terminated. It'd be the same as saying we passed this health and safety policy that everyone has to wear hard hats. It's a reasonable policy, and this person's just simply refusing not to wear it. So we're going to terminate them for failure to abide by our health and safety policy, and that would be cause for termination. I say in this case, it's no different. Obviously, there's still some nuance to it, and you have to make sure that you've applied the policy properly, accommodated for the religion and medical issues that we talked about. But I think you would have a strong case that you wouldn't owe severance in that circumstance. But as we said at the beginning, not determined yet, and so it's still an open question.
Yeah, and it's not determined yet, but as Scott said, the position that we'll be taking, representing employers, is that, a breach of this policy is no different than the breach of any other policy. If you have policies against, code of conduct, on professionalism, insubordination, while some of those are also common law principles, if someone is aware of the policy, has been provided, a fair and reasonable time to come into compliance with the policy, and still chooses not to be compliant, then it's like any other termination of just cause, where they can be terminated for just cause and not entitled to severance as a result of it.
And it's also another issue to keep in mind when you're implementing the policy. The more advanced time you're giving people, you're essentially putting them on notice that if they don't comply with this policy, their employment could end at some point. So that, the alternative argument to just cause is, well, you were given advance notice of this change in your employment. and you had an opportunity then decide whether you wanted to stay during that period or leave and do something else where you wouldn't be required to be vaccinated. And so it's another consideration within how fast you bring the policy into force.
A question, and having taken your duty to accommodate training myself, not related to vaccines, I know that there is an undue hardship factor related to accommodations. So can you terminate based on undue hardship on the organization, even if the organization has attempted or fulfilled the duty to accommodate?
Absolutely. So the test, so keeping in mind that undue hardship is a high threshold, the question is there any way to accommodate this person so that they can do their job safely without being vaccinated, right? So if you have someone whose job is to go and work with elders in their homes, and you've passed a policy saying that we require you to be vaccinated, and there's no other work that they can do, there's no other way they can protect themselves, and there's no way that you're feeling comfortable, you can say that it would be an undue hardship to continue to employ the person doing that job without being vaccinated. But that one, undue hardship, just like any other, I highly recommend you get legal advice before you pull the trigger, because you want to make sure that you've thought of everything, you actually are at undue hardship, and because now you're looking at a potential human rights complaint, which is a whole different animal than a wrongful dismissal claim.
I'm going to go to one of the questions that was asked in advance that I think relates to this, is can you reduce an employee's wages because of a reduced role that you've used because they did not comply with a vaccine policy, which I guess relates to all the implications of how much change can you make to an employee's job description and their role and all those things if they're not complying with the vaccine policy. And then what are the implications of that?
I think, Josh, you can answer this one.
Yeah, absolutely. So the answer to that is yes, you can, in the circumstance of transitioning that employee out of what their current role may be, say to kind of dovetail to Scott's example of going and visiting elders. His example was going and visiting elders, you must be vaccinated, and if there's no alternative employment, then you're in violation of the policy and you'd be terminated for just cause because it's undue, the employer suffers undue hardship. But let's slightly change that example and assume that there is alternative available employment, that by transitioning that employee out to that new position would not cause undue hardship. But that new employment is of slightly lesser degree in terms of seniority and pay and all the rest of it. When you transition that employee into that new role, then they have to assume that level of pay and all the rest of it too, right? So you can't mandate that you be transitioned into a senior manager role, into an administrative role, but require the same amount of pay. As part of that accommodation, accommodation, courts have said, is a two-way street. So as much as the employer has an obligation to accommodate, the employee has a similar obligation, an equal obligation to participate in that reasonable accommodation. And sometimes that may require a reduction in both status of position as well as pay.
Yeah, exactly. The entitlement is to a reasonable accommodation, not a perfect accommodation, is one of the things they talked about. And so a perfect accommodation might be, well, I want to do this other job, but I want to make the same wage. Well, that's not what you're entitled to. That's not the reasonable accommodation. Is we'll give you this other job, but you get paid what the job pays.
Just for my question, you're using the word accommodation, which is the legal term accommodation. So this only applies when it's dealing with an accommodation, not just someone has said they don't want to get vaccinated, and so you're going to make these. That's
right, and it's actually probably the number one, where people get confused, right? Is someone's asking for an accommodation, and the accommodation general meaning could be, we're just asking for you to put this policy aside for my purposes because of my personal views. Well, that when we're talking about accommodation, we're talking about in the sense of a human rights accommodation. The duty to accommodate only applies, like we said, for this policy, we're talking only religion and medical. There may be some other ones that haven't tested yet that people are going to take a run at, but it has to fall within one of the enumerated grounds. And so your personal preference not to get vaccinated is not going to be a protected ground that needs to be accommodated. Having said that, right back to the beginning, when we look at the why, what kind of policy are we implementing? Are we building in an exemption, we'll call, rather than accommodation, an exemption for people who can do their job remotely or something else, where we're going to allow an exemption to it, but there's no duty to accommodate. You want to kind of clarify, if you're going to use that word accommodate, you use it with respect to the legal meaning on a human rights complaint.
One more from the chat, which you kind of covered, asking, is it legal to ask if someone's vaccinated or not vaccinated prior to implementing the policy, which you talked about, but I know you can probably elaborate on how to do that and best ways. But I'm going to add to it, in hiring, is it legal to ask a potential employee if they're vaccinated or not vaccinated? So I've added a part B to the question.
Yeah, and perhaps I can address the part B of that. And actually that was asked by Glenn Jones in the chat from Vaccination. And arguably the best time to implement the vaccination policy is pre-employment. So you can make it as a condition of employment that the employee be vaccinated prior to the commencement of. So you just make vaccination or being fully vaccinated as a condition subject to employment. And we get into other legal nuanced issues about consideration and acceptance and all the rest of it. So we'll avoid that for this conversation, but just confirm that yes, the best time is pre-employment.
Yeah, and so you can actually have different rules for new employees coming in, where you require all your new employees to be vaccinated, because the concern, remember, when we're talking about these vaccination policies, you're bringing in a policy that's new, right? So you're bringing in a new term of their employment. So that's why it has to be reasonable, has to be, all of those things. When you're looking at a new employee, you're not changing, you're telling them up front, and your only obligation then is to accommodate any religious or medical condition that they may have. So the human rights still applies. And then taking a step back, the previous question, can we ask? You can ask, but you have to collect the information in a way that complies with your privacy policy. So you need to make it a confidential inquiry. You need to make sure that the information is stored in a safe and secure way, and you're not sharing that information with anyone else. So that means, when you're talking about, council says, well, what's our vaccination rates? You've done a confidential poll, you've had people provide me proof, whatever it is. Okay, now you're not saying, well, Joe's vaccinated and Fred's not. And what you're saying is, yeah, we have an 80% vaccination rate or a 95% vaccination rate, without identifying who's not vaccinated. That's the way to protect the privacy issue. That's really the only consideration, but totally fine to. And we actually recommend, as a first step, we do it with most organizations, if you don't have a good handle on vaccination rate, get one first, so that you know what you're dealing with. If if you're all of a sudden, holy, we only have a 25-30% vaccination rate, we've got a problem. We're probably going to have to focus on some education first, so that we don't lose 70% of our workforce. How are we going to get these vaccination rates up before we implement the policy type thing?
And to kind of piggyback on Scott's comments, and I apologize, we had to kind of skirt through the privacy issues of these policies, is that when it comes time to drafting, that's something that we will always include is a privacy consideration in the policy itself. But then in addition to that, subscribing or naming a particular person to whom that information is to be given. And one of the reasons doing that is obviously to limit how that information is shared and to maintain its confidentiality. And in some circumstances, if you've confirmed that an employee is vaccinated, you only need to do that once. And once that is confirmed, in effect, you could probably even, destroy that information if it's reasonable in the circumstances. So, again, these are all things that we can assist you in addressing if and when it comes time to you implementing your own policy.
As we hit 11:45, I just want to reiterate for everyone who's having, or anyone who's having to go, that we will definitely be sharing the slides as well as the recording of this out with everyone who's registered. And we'll also be sharing the recording publicly on the FNPSS YouTube channel So someone had asked, can they share it with their chief and counsel, or can you share this recording with somebody else? Of course, absolutely. You'll have the link, you'll be able to share it, and hopefully find it useful. And if Scott and Josh don't mind, I'll ask a couple more questions here, but we've got a few more minutes. One on testing. Can you do weekly rapid tests on staff, whether they are or are not vaccinated? Or I guess for that matter, can you ask staff to perform tests of any kind, whether they are or are not vaccinated?
The rapid testing, so that's going to get into a whole nother realm. So essentially you would have to implement a policy that sets all that out with all the safeguards and everything else, and you run into the same issue of all the same issues that we're talking about here about vaccination, because it's you're asking them to give medical information, so you have to have all those same safeguards in there, all of the same issues, and be prepared to deal with any objections to it. So that would be another talk in and of itself. And so I think we do, but essentially it could be done, but there would be risks involved.
I'm seeing there's some comments, a number of thank yous to you both in the chat. I'm scanning to see what questions I've missed. But if anyone is still online and you want to ask a question that I've either missed in the chat or you want to jump in, please feel free to raise your hand, and happy to ask the question yourself. Group that prefers chat. I got the thumbs up from Mark, but I think that's a thumbs up. Oh, it's a raised hand too. Go ahead, Mark, please.
Just wanted to find out the lawyers, thank you very much for the details. There was a list of accommodations that provided, you can call them 8 human rights related accommodations. There seemed to be a standard, so someone couldn't create their own accommodation request. There's a hierarchy of standards that have been approved. Where would I find such a thing?
Sorry, I'm not sure I understand. So hierarchy of like what I listed was maybe I'll share my screen. Is this the screen you're talking about? I think this might be what you're talking about. The types of potential accommodations you'd be looking at. Sorry. Just requesting alternative work duties, this is just kind of it's not meant to be an exhaustive list. They're basically accommodation is as broad of anything you can think of that works for you and the employee, and you need to be creative, is what the courts have said. You need to try and figure out a way. When you're looking at a true medical, religious, whatever accommodation, you need to be creative. You need to go all the way. That point of undue hardship is way up here, so you try and find ways to make it work so that the test is to figure out a way that an employee can do the job, right? Can work for you with whatever limitation it is they have, whether it's religious, medical, whatever that prevents them from doing a certain thing. Let's find a way for them to still work.
Thank you.
No problem.
Does anyone else have any questions they'd like to ask live and in person?
And yeah, if it's a specific question to your nation, and you're not obviously not comfortable coming here, and we can only provide such very limited advice in this forum because we have to be careful what we say. We're happy to have you reach out to us directly after this, and we're happy to talk to you about any of these issues.
Wendy, please go ahead.
Hey, thank you. I was just wondering about if you have any recommendations for determining a risk to critical employees being impacted by a vaccination policy.
Yeah, so it's a difficult one, short of that going through and doing that analysis in advance, trying to find out who's vaccinated and who's not. And then, the person who's in charge of storing that information is going to know if there's critical employees that are going to be impacted. That can help to determine, yes, there would be a critical impact, or there would be an impact of this thing, but there's only so much because of privacy limits that you can do in advance. You have to consider the fact that if you do make a blanket policy for everyone, you may lose a critical employee, and that's something that council should be considering in passing these policies, whether they want to leave the door open for some exemptions.
One more question from the chat then. Is how would you provide proof of vaccination to third-party contractors? I'm assuming there's privacy considerations there.
And so provide them with your proof of vaccination, or have them provide you. So if you're asking third-party contractors to provide you with proof of vaccination, it would be covered in your policy. Here's how we protect that information. Here's the privacy issues around that. If third parties are asking for that information, then it's a bit more difficult process. That individual would have to provide that information, and they should have privacy policies to protect that information.
So that would be up to the individual. The employer can't say, employee, you have to provide this information to this third party.
No, and so there may be consequences if the employee doesn't, so that the employee can't go to work at that site. But the employer can't provide it on their behalf without their consent.
I hope that answered, Chantal. And Wendy's just asked again, what about applying the policy to elected officials?
So I have nations that have applied it to elected officials. The elected officials obviously agree to that. And so because they're elected officials aren't employees, they're just a completely different creature. They're elected officials. They may have political views or other views that that you can't put the same controls or constraints on an elected official as you can on an employee. And so if there would be no issue with having a policy applies to everyone but elected officials. If they want to include elected officials, then the issue becomes, how do you enforce it? If you apply it to all elected officials and one of the officials says, I'm not going to comply with that, I don't agree with that, how do you then enforce it? So there would have to be some kind of ability to enforce it within the council's own bylaws, the custom election code. That goes way beyond what we're talking about today.
And now I'm gonna hazard, oh, Mark, you just raised your hand, please jump in.
Just a clarification on the third-party contractor, because I believe I'm in a experience a similar issue. As a third-party contractor working for a nation and arriving at their offices, I'm a person who, if they have an employee mandate that everyone in that office has to be vaccinated, I'm a third party that's been hired by the government to do a service. What obligations does the employer have? Because obviously I'm thinking of the front-end staff. They've got nation members that have to be vaccinated to come in the door. I'm a third-party contractor, or others like the coffee repairman or the coffee delivery guy. How do we mandate and control those disease vectors into the workplace?
Through policy. So that's one of the options that you have. Many of our policies include third-party contractor requirement that they all be vaccinated, and so then you have a process for them to prove their vaccination prior to them coming. So if you have the water delivery guy has to come in, then you tell that company your employee has to be vaccinated in order to show, and they're going to have to provide proof when they get here. You just tell them in advance, but it's something that you can cover in the policy. Again, it's something where you have to turn your mind to, do we want that in the policy? What happens, is there going to be any negative effect if we do put that in the policy? So it's all just the same consideration, but it can be included. We have done policies that include all contractors, all third-party contractors, chief and council, basically everyone that they have any reach or control over.
So just a clarification then. So then as a third-party contractor, that person's employer is told that's a requirement to come onto this job site. Then part of that requirement is, by the policy, is that that contractor must show proof upon arrival to the staff as work.
So they could ask, that could be part of the policy, that they ask for proof upon arrival. If you refuse to provide that proof, you're refused entry into the premises, and then it's up to your employer to deal with that, right?
Yeah, that's empowering for the communities. Thank you.
Mm-hmm.
Have I missed any questions in the chat, which is entirely possible because there was a lot of of chat. If I have, please go ahead and either jump in or type it again. My apologies. And if not, if we actually manage to get to them, Bronwyn has put a link to a short evaluation survey in the chat, which we very much appreciate if you can take a few minutes to fill out. FNPSS generally plans these webinars based on the requests that we're getting from First Nation administrations and governments for information. But if you have ideas for webinars that you think you would like us to put on, that would help your government or your administration, or you want to provide feedback on this webinar, things we could have done better, things you would like to see, please take a few minutes to fill it out to help us. And this would be, I guess, a last chance for any questions as we're coming up on 4 minutes to the extended time. Marie's just asked, because the First Nation exemption from the legislation, I'm guessing that's the federally regulated, are we more likely to be sued?
In my view, it slightly increases your risk, just because you can't then just say, well, we didn't have a choice, the government made us do it, which is, you know, an easy out for the companies that are covered by this mandate. They're pointing to this, but at the end of the day, if your council as a government is making the same decision for the same reasons, then it in our view, it's really no different, and it shouldn't be treated any differently. That was the whole point, was for the government to say, you guys make this decision, you know, this is part of our not trying to make not making these decisions for you. You're an independent government, you make that decision for yourself. And so to then say, for a court to then say, we're going to hold you to a different standard than we're going to hold the provincial or federal government to, it's not reasonable.
Yeah, it's just another form of government, right, Scott? You got the federal government, you got the provincial government. They're introducing these mandatory vaccination policies by virtue of, you know, legislation or otherwise. You've got municipal governments that are doing the same thing, you know, whether it be Vancouver, Calgary, Nova Scotia, Toronto, and then you have another form of government, then that is First Nations and their right to self-governance, and they can implement, you know, very similar types of policies and or, you know, a version of legislation in that context is, you know, passing a bylaw, right? So and I agree with Scott, you know, on what basis would there be a rationale to treat those governments or those levels of governments powers or decisions to implement mandatory vaccinations to distinguish it from First Nations? There isn't any. So
in fact, yeah, and I guess the other point is that the First Nations that I've dealt with that have already done these policies, a lot of them are looking at being in a very, very unique risk sector because they're remote, their elders are at risk, they've had significant issues with this pandemic that are even greater than what is being legislated by the other governments. And so them passing this policy is, in my view, even more reasonable than with the province or the feds.
I'm going to sneak in one last question. Marie's just added, for a First Nation, pass a bylaw instead of a policy. I think that was related to something you mentioned, Josh.
So my view on that would be that, yes, they should be passing bylaws for all of the stuff that deals with the community and everything else. When you're dealing with employees, it's essentially you want to do it through a policy. So it's essentially a policy that applies to the employees. It's a different analysis for employees than it is for what they're regulating within the community. The bylaws could have an impact on the employees, and that, like we said, if you want to go into the center, just because you're an employee, you don't get to be exempted from the bylaw. It still applies to you. But if you want to deal with all your employees and make all employees covered, because remember with employees, you're talking about, you know, sometimes it's going to be employees who work from home and aren't really necessarily an immediate threat. Do you want to include that? You need to do that through the better way to do that is through policy, not through bylaw.
And with that, I think we will end. It is 12 noon, and thank you, Scott and Josh. not only for your time, but even staying on for an extra half hour. And again, for providing your emails for additional questions. As we promised, we will send out the presentation and the recording to everyone who registered. And thank you, Josh, for adding in your contact info one more time. So thank you on behalf of FMPSS to all of you who took the time to listen and participate. And again, Rodman's room put in a reminder about the evaluation survey. Thank you for that too. And again, thank you so much, both Scott and Josh, for your time today and your expertise.
Thank you for having us.
Great, yeah, thanks for having us. It was a pleasure as always. Thank you.
Have a wonderful rest of your afternoon. I hope it stays sunny for everybody. Bye.
Bye now.